Okay, there's a lot of issues kenapa selalunya reform kita fail. Okay. Dan one of the issues is because of lack of political will to pursue the reform, and somehow because of the weakness of the reform team. Okay, jawatankuasa reform itu sendiri lemah, sama ada dari segi technical capacity of the Ministry of Health staff, or maybe their working silos. Okay, but lack of information and of course fighting over control the proposed agency antara Ministry of Health and also the EPU, the role of potential losers like private insurers, lack of transparency and public consultations. And salah satunya yang reform fail ni because of loss of public confidence on government to handle large fund. Ada corruption ke, ada corruptions. Okay, this is because why reform selalunya fail. Sorry. Okay. So, what we need to do to enhance our systems, our health systems. So, these are all the suggestions, okay, that actually we can improve our health systems. First, okay, ada banyak solutions. There are around 6 solutions. Satu, kita decentralize. Okay, seperti tadi yang kita cakap awal-awal bahawa everything is centralized in under Ministry of Health. So the first solution is we decentralize our Ministry of Health, and then we give the priority on the preventions rather than treatment. Guess what? There's a lot of preventions, and you all as a nutritionist, this is your job to prevent, especially on the NCDs, non-communicable disease. And also another solution is we need to active in terms of the research and development in health, in terms of we need to get the social health insurance, enhance efficiency, and also it's very important to have an effective human resource planning. Okay, nak berapa orang doktor, nak berapa orang kepakaran dan sebagainya, it must have a very good decision. It must have a very good planning from the healthcare system. Okay. So first we go in terms of decentralized the health services. Okay. What is means of decentralized? The transfer of authority, responsibility for public functions from the central governments to the intermediate, or we pass down the cascade the responsibility to local governments or quasi-independent government organizations and all the private sectors. This is the World Bank definitions of decentralization, and it's a complex multifaceted concept. Okay, so the benefits of decentralization is, of course, is more rational and unified in terms of the health service that caters to local preferences, and improve implementation of health program. And by decentralization also, it can increase in terms of duplication of the services. Kadang-kadang ada duplicate, orang ni buat, orang tu buat and as the target populations are more specifically defined, there will be a reduction in equalities between rural and urban areas, not focusing only on urban areas, but also we look at in terms of rural areas. And in terms of benefits of decentralization also, in terms of cost containment from moving to the streamlined targeted programs, greater community financing and involvement of local communities, greater integration of activities of different public and private agencies, and as well as by decentralized the scope or the job or the responsibilities, we will improve the intersectoral coordinations, particularly in local governments and rural development activities. Then what the Ministry of Health have to do is that they transfer the ownership of hospital and clinic to regional health authorities. Okay, that will be a good suggestion in terms of we want to do the health sector reform and combine the state health and medical services departments as fully functioning regional health authorities, and greater autonomy given to the hospital to provide services, and also the regional health authorities given full responsibility to plan, deliver and monitor health services. Maknanya kita bagi autonomi tu kepada hospital untuk how they want to provide the services. And also we give the regional health authorities macam mana they want to monitor the health services. We decentralize, don't give to totally under the Ministry of Health. And limited number of hospital owned and maintained by MOH directly, seperti National Reference Center, Specialized Hospital, kan kita ada Institut Jantung Negara ataupun kita ada juga National Cancer Hospital, Institut Cancer Negara dekat Putrajaya tu. We have our mental institution, respiratory center and also hospital for infection disease. Kemudian kita kena also transform the role of Ministry of Health by apa yang dicadangkan adalah untuk kita develop the health policy, ada health planning and development, regulation and enforcement in terms of licensing and accreditation of hospital and clinic, monitor the private providers, minor role as service providers and health promotion and preventive services. So these are only the role of MOH. Yang lain semua kita cascade down to the other institutions that can help in terms of running the responsibility. And another transfer role of a Ministry of Health to enhance the role of Ministry of Health in monitoring and evaluations. They do the benchmarking of hospital, set and monitor the KPI, and then they have what we call as health management information system and systematic collection of health information, more detailed and high quality data to support strategic decision making and as well as high quality data analysis. So this is all the multiple role of MOH lah yang kita nampak tadi, dan kita tahu bahawa kita nak transform daripada sini kepada sini sahaja. Maknanya daripada 6 they have to do the education training juga di bawah Ministry of Health, R&D Ministry of Health, policy maker Ministry of Health, funder, regulator and provider. So actually kita want to transform the role MOHD into kepada service provider, health policy and monitoring evaluations. These three enough actually in order to to get a good quality of health services in Malaysia. Dari segi priority on prevention, of course kebanyakan perbelanjaan yang telah diberikan every year by our budget is more kepada our healthcare system lah. And then because of a lot of penyakit, a lot of diseases, especially the NCDs, the non-communicable diseases, will affect the budget of our country, Malaysia. So it is very important the solutions from the government in terms of we want to reform is we concentrate on the prevention. There's a lot of prevention program need to be done by the Ministry of Health ataupun as a nutritionist. Actually we have a higher spending on preventive. We need to higher spending on preventive and promotive services. And by empowering the community and local authorities, we need to have a lot of innovative approach in prevention. Banyak approach. For example, there's a lot of applications right now that help people to prevent them from getting diseases. This is what we call as an innovative approach, and focus on primary and secondary prevention. Train more health workers on prevention and promotion, and train more public health medicine specialists. These are all the priorities that need to be given in order for us to give a full ataupun in order to give a very efficient, effective services to the consumers lah. Next, also the proposed solutions is we need to have a very active in research and development in health, where kita establish a National Research Council as a Korean model. They have their own NRC, National Research Council, where this can help to collect all funding resources and that we put under the NRC. And this research funding is a competitive basis and stop block research funding directly to specific agencies or ministry. Dan di mana kita as a researcher kalau as a lecturer also we need to get a fund in order to help to find a new fundings in terms of diseases, also in the preventions lah, and of course enhance role of universities in research and development. Okay, next adalah in terms of social health insurance. Okay. Also it's suggested in order kalau kita nak membantu dari segi to increase the efficiency of our healthcare system in Malaysia, is we need to establish a national health fund based on the SHI concept outside the Ministry of Health. Ataupun kita panggil sebagai NHF, National Health Fund. With this fund actually can coordinate contribution from public and private sector, where kita akan boleh kenakan in terms of introduce provider and purchases split, and this can help to set up multiple agencies to process payment and claims from the providers. The national health funding system ni must be set up by a legal profession and must be a public NGOs or a public non-profit organisation where they were responsible for all aspects of policy development, and also they need to have a strong link and control cabinet, monitors the implement of health financial punya monitoring, and also appoint agent to operate the HFM. Okay, so we can see that here in 2016, the Health Ministry plan for non-profit health financial schemes for us. In terms of voluntary health insurance also, potential strength, more acceptable to population than private for profit health insurance. Easier to set up than social health insurance, the SHI. So what selalunya apa yang potential yang kita boleh buat adalah more freedom of choice to enroll. Banyak sekarang ni orang kata insurance that you can get, Prudential, AIA and etc. And somehow this government in control since the entity is under Ministry of Health, and you can get a benefit package and might be the same as present, and fund may be injected by the government. Okay. So another proposed solutions that we can get, also improve the efficiency in terms of establish a dedicated independent agency in terms of health technical assessment, health technology assessment, where they can conduct the health technology assessment activities that covering new and existing technologies in public and private health sector. And also we can get the source staff from university that have a proper skills in HTA, and also strict use of economic evaluation in decision making. Then this health technology assessment report should be taken on board by implementing agency. Dan dari segi human resource, it's very important. Give priority. Last kali tadi, give priority to local specialist program. Kita kena bantu our local specialists, to help them, and in training, then actually it start for us to reduce the number of medical schools, where we need to establish more faculty of public health, ataupun kita kena lebih banyak hasilkan school of public health. Kalau ni pun kita akan nampak sekarang ni dah banyak medical schools, the Ministry of Education stop from developing a new program of medical schools, but now we are more focusing into public health, and start the undergraduate training in public health, and also use innovative approach in health or the human resource management. So as a conclusion, actually our Malaysian health system has undergone a series of reformation, a series of gradual development since pre-independent era. Banyak sangat improvement telah dilakukan, and of course there is a pros and cons from that reformations that we need to look at, and we have to go through the 5 cycles just now. If we have the evaluations and we see that there is a problem, then we go back on the first stage to define the problem that we see from the health sector. Then the priority to primary healthcare and rural development has benefited most Malaysian, and now our Malaysian health system need to be transformed to provide effective, efficient, equitable and innovative services to the Malaysian population. Thank you.